ready to go for a walk?
Ann Welsh likes to be on the move, whether it's at home walking her dogs or exploring another country. But for years, urinary incontinence slowed her down.
I always had to wear some sort of protection, and sometimes that wasn't even enough. I actually had to order things online to get to the point where I felt comfortable that it wasn't going to be an obvious leakage. But even just walking the dogs, I had to be careful. No heavy exercise, no hiking, no things that I really like to do. They held me back. Traveling, it was uncomfortable having to travel with all this extra supply of protection.
Finally, enough was enough. She scheduled an appointment with Dr. Jamie Bayshore Long.
She was experiencing the most common reason for leakage of urine that women experience, which is called stress urinary incontinence. It essentially means that there's a force or a stress that causes the leakage. So this is the scenario where there's coughing or sneezing or laughing, exercise, that then causes there to be loss of a small amount of urine.
She just put me at ease the first moment I met her. I was nervous about going and having more testing done and uncomfortable. Admitting the problem was the first issue. And she just made me feel like this is normal. You had 3 children. This kind of thing is expected.
There are non-surgical options.
By placing a supportive device inside the vagina, it holds support underneath the urethra so that when the force or the pressure, like the cough or the exercise event that's going to put pressure down on the urethra and the bladder occurs, there's something there to support the underside of it so it doesn't allow the urine to escape. So that most commonly is a pessary. And a pessary is something that is non-surgical. We fit a woman for it in the office, make sure she's comfortable with it, and then teach her how to take care of it herself often, so that it becomes a medical device like a pair of glasses or a pair of contacts.
But Ann decided to have surgery, a permanent fix.
It takes about 15 to 20 minutes to do. The woman will go home the same day. She has pretty minimal pain. And it either completely cures or dramatically reduces stress leakage in about 90% of women who have it done.
The one nurse, when I set up the surgery, she said, "So you're going to be a member of the club?" And I was like, "What club?" And she goes, "The Dry Panty Club." So they just made it so much easier to talk about it. And I was so happy to go back and say at my last appointment, I am officially a member.
Ann is now free to travel and live her life worry-free.
My biggest regret is that I didn't do it years ago. That's my only regret about the surgery. Otherwise, it's heaven. I can walk and sneeze at the same time again, which isn't something you want to do, but you can. You don't have to stop and think, oh my gosh, I should go to the bathroom quick again before I go to this meeting, or getting up from a chair, sitting in a movie theater. I don't have to worry about any of that anymore. It's just such a relief.